Hello everyone, this video will be aimed at those who are suffering from a tibial tubercle avulsion fracture. In this video, I'll give an explanation of what that is, the detail about the surgery, the recovery, and a timeline of the rehab and physio process. To begin with, I'll give some background information about the injury. A tibial tubercle avulsion fracture involves the tibia. That's the shin bone just underneath the knee. A part named the tubercle near the top of the tibia tears away or avulses, hence giving the name Tibial Tubercle Avulsion Fracture. The fracture site can be seen here. I'll just circle it right now. And this bone tears away like this. To understand why this part of the bone tears away, I'll add the ligament that inserts into it. This ligament is known as a patellar ligament. It's attached to the quadriceps and it's how your quads extend your knee joint. Here's an animation to help us understand how the quads extend the knee joint. The quads are attached to a bone named the patella here. The patella is connected to the tibia via the patellar ligament. When the quads pull the patella then pulls on the patellar ligament, which is attached to the tibial tubercle. This then extends our knee joint. When the quadriceps pull too hard, the patellar ligament can then pull a piece of bone off the tibia. This piece of bone is the tubercle. So when does this injury actually happen? The fracture usually occurs during the spring or landing of a jump. Essentially, it occurs when the quads are contracted aggressively. That is why it often occurs in basketball. Here is a side-on X-ray of a fracture. On the left you can see the tibia, and on the right you can see the femur, or your thigh bone. Here you can see the part of the tibia that has come off. It's been pulled away by the patellar ligament. This is what will be put back into place, and then fixated with screws during surgery. So now I'll take you through what's going to happen during your surgery. The most common type of surgery for this type of injury is called open reduction with internal fixation, or ORIF for short. I'll take you through what this means step by step. Firstly, a cut will be made down the middle of your knee. This cut will vary in length depending on your fracture and will leave a scar. Here is a side-on view of a fracture. Once the bone has been exposed during surgery, the site will be cleaned as best as possible. Then the bone will be realigned by hand into its original position. Once realigned, a total of 2 screws will be inserted to fixate the fragment. Any additional damage to the ligaments or other structures in the area will also be treated at this stage. Once the fragment is back in its correct place, the bone should start healing naturally. Around 10 to 15 stitches will be used to seal the site, and now the operation is complete. Depending on the type of stitches, you may also have an appointment with a medical professional to remove them after around 2 weeks. After surgery, your leg will be immobilized in a cast for around 4 weeks. This means that you cannot bend your knee at all. You will require crutches to move around. You will also feel pain and discomfort in your knee and receive painkillers to help manage it. Once your cast is removed, it will be replaced by an adjustable brace, as can be seen on the left. This means you can start to bend your knee bit by bit by adjusting the slider that says flexion. There are 2 main parts of physio during the rehab process. The first is to increase range of motion, which means to be able to bend your knee more and more. The second is to regain power in your quadricep muscles. Increasing range of motion will be done passively using gravity and your other leg to help you. You should aim to progressively bend your knee 15 degrees more and more each week until you can fully bend it all the way. This can be controlled by your brace so that you don't ever have to bend too far. The rehab focused on power is more complex and mainly involves strengthening the newly weakened quads. It may begin at the most basic of exercises. To start with, you may need to wake up your quads. This is because they have detensioned and haven't been used in weeks. This involves learning how to tense or flex your quads again. You may be able to do this immediately, or it can take multiple days. The next step will be to practice moving your leg towards you. You can practice this by sliding your heel with a towel underneath the knee. You should keep training this for a week. The next stage will be lifting your knee passively and then actively against gravity. This may involve exercises like seated leg raises and prone leg raises. The following stage is straight leg raises. These are needed to be able to progress into walking properly, which will take a different amount of time for everyone, depending on how the rehab is going. But for most people, walking usually takes about 8 weeks. Strength rehab continues far after walking. You should continue strength rehab on your quads for at least a year to match their original power. There are now a variety of exercises that you're able to do to work on your leg power. The screws from the surgery can stay in the knee for life without consequences. You don't need to take them out. In the case that they do cause discomfort, they can be removed. This will require another surgery, but note that this surgery will have a faster recovery. The chance of refracture is low at around 5%, but care should be taken during activities that would involve a direct impact on the knee, as well as in jumping sports. The best way to stabilize the knee joint is to strengthen the muscles around it. Rehab is pivotal in avoiding a refracture or a rupture of a patellar ligament. There are risks of infection and complications of the anesthetics, the same as any other surgery. Let someone know if your wound has increased heat, redness, swelling, or fluid leaking from it, as it may be infected. Bursitis is where fluid-filled sacs that cushion the knee joint become inflamed. It is treated by removing the screws. Fortunately, the fracture on its own should not increase the risk of arthritis, as the injury is outside the joint space. This is probably the part you want to know the most, and it's good news. Although the weeks after surgery will be difficult, full recovery is very likely. Walking without crutches will take around 2 months, and a full return to sport and running will take around 4. Knee pain will normally completely subside by this time. 98% of patients will see a full return to original function within a year, and can be back playing sport at the same level as before. Just some final words to close off this video. Stay consistent in your rehab. It may be demoralizing at how little you can do to begin with, but consistent physio is very effective and can speed up the recovery process by a mile. And a reminder to keep a positive outlook. This injury is fixable. With modern medicine, you regain original function. Without it, you would have never walked again. And finally, although this is a physical injury, it will also pose a major psychological challenge. Keep your head up, and I hope you've been able to learn something useful in this video. I wish you the best of luck in the recovery process.